Good afternoon, friends. David Wright here, and I'm your host of the Disruptive Innovators Champions of Digital Business podcast. And today I am lucky enough to be joined by Scott Murray. Scott, pleasure to have you on, man.
Great. Well, thank you for having me. I'm looking forward to this conversation today.
Absolutely. I know it's a long time in the making. Scott, for those of our listeners who may not be familiar with your body of work, can you just tell everyone a little bit about where you are today?
Yeah. So I'm in a company by the name of Collective Health, and we are a platform that really delivers administrative benefits from a healthcare standpoint to self-funded employers. So those employers that ought to take on the risk versus having that risk carried with the large carriers, which is also known as fully insured.
Got it. Yeah, and I'm super excited to dive more into the work you guys are doing. It's been really intriguing to me. Before we do, we always just to start each episode with one piece of actionable advice you might look to leave the listeners with today.
It's interesting, David. I've been rereading an old book, which is Good to Great by Jim Collins, one of my favorite books. And one of the concepts in there is about confronting the brutal facts. And when I look back at major changes in my career and when I've been brought in to firefight on something, which is part of what I'm known for in my career, it's this concept: don't give in to the fear, but rather lead. Don't let the fear drive your actions. And so when you start confronting the brutal facts, like, it lets you get into the details and drive action. So my piece of advice would just be like, don't let fear control your destiny, whether it's in a company or even whether it's in your personal life. Lean into it and drive forward, and you will come out the other side.
Boom. All right, we can end the episode now. That is just it just rings so true for me just throughout my professional career, but in particular as an entrepreneur. I really had to go through the process of learning how to not let my life be ruled by fear. Because for a long time, I was acting out of fear of not getting what I thought I needed or losing what I had. And you can operate there and be like successful, but it's for me, it, I wasn't operating at the top of my kind of from good to great, right? I was probably good at that point. And then secondarily, it was just a miserable existence because you're crippled by that fear. And today, leaning into it and getting comfortable being uncomfortable, right? Is just something that it took what it took, but wow, thank God, because I've learned that I don't need to change. If something is upsetting or difficult or uncomfortable, that's okay. That's life. And anyway, I'm interested, Scott. You've had such a cool career, and I know you're an advisor at a number of different companies, and interested to learn how you started out and how you got to the point that you're at in your career today. Just a little bit about your journey as an executive.
Yeah. I started off at Safeway grocery stores when I was 16 years old, bagging groceries, actually on my 16th birthday. And what I later would come to learn, and it's come full circle with the customer being at the center of everything I do. And I remember having a store manager at the time that just pounded that into me. The customer's always right. That was the mantra back then. And I was like, yeah, the customer's always right, but. And so it was always an intriguing thing, a question that I would ask myself. But I always, for the brand of the company, I always went with, yes, the customer's always right. And stayed with Safeway through college, ended up in a corporate development management program, and ended up at corporate and designed pretty major systems for this entire supply chain of Safeway. And so going from bagging groceries when I was 16, working there through college, ending up in the corporate kind of side of Safeway was interesting for me. And I stayed at Safeway for about 13 years. And then I went on to work for a publishing company that was basically based out of the UK, 250 different business units. And I had to come in and consolidate business processes and systems across those 250 different business units. And that was fascinating. And then I went to eBay, and I was at eBay for roughly 17 years, joined when it was 900 employees, went through the heyday to 36,000 employees, 36 countries. And then I went to Collective Health, which is where I am now. And what I would say is back to my opening comment about advice I would give. When I look at those moments when I took a big leap in my career, and I just remember thinking back to those moments going, man, I don't know if I can do this. Wow, this is a big job. Or at eBay, when I was tapped on the shoulder to go run customer service with 14,000 employees in it around the world, I was like, really? You want me to go do this? But I look back on those moments and they were defining moments in my career. And I'm so glad that I leaned into them. And it was the same thing at Collective Health. I was like, wow, I'm going into healthcare when I don't have a healthcare background. And so what I would say is the theme, if you get, and I didn't set out to do this, but the theme throughout my career has been people, process, technology, and culture. And how do you bring those things together to drive business performance? And so I look at all those different dimensions. And so I think my orientation of starting off with the customer at Safeway and then going into systems after the fact, and then looking at business processes when I was at Miller Freeman Publishing, and then bringing all that together at eBay to help drive innovation and help accelerate the business and go into new countries. And then coming here to Collective Health to put a consumer lens on healthcare and drive innovation. It's this amazing culmination of my career, all the great things that leaders have had trust in me that I could do. And now I get to bring that to Collective Health and do that with other leaders.
Yeah, I love that. I've seen at least a few health systems, health care providers, payers invite folks with experience outside of healthcare into the healthcare world. That fresh perspective, I think, is so necessary right now and can add so much value in an industry where for many years there was largely recycled air. And coming from the perspective of, in my opinion, for a long time there was this kind of hierarchical relationship between a patient and the healthcare provider or healthcare organizations where you didn't have ready access to your data and you weren't necessarily informed and you were beholden to whatever it is. It's such a vulnerable place, right? And meanwhile, from Delta or Amazon or anywhere else I'm a customer of, that type of relationship would be completely unacceptable, right? It's so great to see someone like yourself with that, bringing that perspective to the healthcare industry to better serve these patients.
Well, and it's part of you're spot on, David. Like it's part of the founding story of the company. Like Ali Diab, our CEO and founder, the company started all because of a healthcare issue with him. And he was confronted with a choice while he was on the operating table about two choices in his life. And then after the fact, once he makes the decision to go down a path, after the fact, he has to fight with the insurance company to basically get his claim paid. And yet he's working at one of the top companies in the Valley and with the best insurance, and he can't get his claims paid. And so instead of him focusing on recovering from his health issue, he's having to worry about healthcare bills. And that is exactly why the company was founded and why we call our customer service people member advocates, because we're here to wrap ourselves around the patient and guide them through this complicated healthcare system and to just cut through it. And it's what is needed in healthcare because otherwise it's very confusing. And it's this black box over here that you got to try to interpret. And it's not easy.
No, not at all. I admittedly, here I am, like we'll often serve health systems and payers as in our consulting practice. And I leave it to my wife and my other trusted colleagues to help me sort out like all of it because it's complex. And if it's complex for someone like me who works in the industry, so many people every day are taken advantage of, right? That's really sad, especially the folks that don't have. So it's great to hear that you guys are building kind of that advocacy because that's really, I think it's a great word for it because that's really what's required.
Yeah. And part of the reason why I joined Collective Health is I had my own healthcare issue, quite frankly, while I was at eBay. And I was pretty much on a path to becoming blind. And it took a team of doctors that I trusted that were highly innovative, that came up with solutions that were not common to treating basically this very rare autoimmune disease. And then I found myself after the fact, like fighting with the insurance company because they took an innovative approach. So here you have providers that are trying to do the right thing for patients. And you have the insurance companies where it's in conflict with what the insurance companies are doing. And so here's the patient in the middle. And yet you've got these providers that are doing this amazing work. And meanwhile, the patient's sitting there and you've got an intersection to go down. And I had doctors that were willing to fight and to come up with a case as to why something was needed. And so most people, I'm a problem solver by nature. So I was finding a path. And so to your point, we're pretty well equipped to be able to navigate and do the problem solving. There are a lot of people out there that are not. And that's part of what we're solving for as a company.
Love that. I want to talk a little bit more about collective health. Before we dive into that, I mean, your journey has me really intrigued. And I'm wondering, is there some of my biggest moments of personal and professional growth actually came out of, you reference this to a certain extent, like really difficult situations, and I can think of one in particular for me that was like very personal and I wasn't sure like it was so brutal, but keeping that kind of leaning into the fear and all of that, I came out of it and it was just transformative. Is there a time that sticks out, like a moment or a story in over the course of your career that it failed or way kind of a out in your mind?
There's probably two, and you can choose whichever one you would like. But one I would say is a failure, and I would say the other is walking into something that looked like a massive tidal wave that I had no idea how I was going to get to the other side of. And what I would say the first one, it was actually at Miller Freeman, and we had decided to develop a system that was going to be state of the art, but very innovative, very different. And it was for the trade show side of the business. And fast forward, like the consulting firm that we hired, the vendor that we hired, all failed. And I had to walk into the CEO's office and basically tell him that I cost the company a lot of money because it was right. And I just remember I could still see myself, actually, this is back in the 90s. I can still see myself walking into that office with my tail between my legs, going, man, this is my last day at this company. Been a fun ride. And the CEO looked at me and he said, Scott, he goes, I want you to learn from this experience. This is one of those moments in your career where you know what it's like to fail and you will never do it again. That was the lesson I got from the CEO. And to this day, I'm in touch with that CEO and he gives amazing advice. And that was so profound for me to where I pretty much actually demonstrate that in my own leadership with people to this, that we're human, right? Things are out of our control in a lot of cases. There are a lot of variables in the type of work that we do. And you've got to get every single one of those variables to line up for those ones that you're not in control of. And you got to give people some grace, obviously with limits, but you got to give people grace. But that was a really big lesson for me. I would say the second one is when eBay in 2008, when we were in a significant turnaround, the stock market had plummeted, financial crisis. eBay stock went from a high down to single digits. It was terrifying. There were our darkest moments. And I was tapped on the shoulder. They were taking each of the VPs and saying, you're going to go run a part of the company and help turn the company around. I was chosen to go do customer service. And I was like, wow. So it was one of those moments where I was terrified. I was like, what am I doing? 32 countries, 14,000 people, big operation. And I jumped into it and just started taking it piece by piece. And on the other side of it, we brought the nose of the plate up at eBay. And it took a team, it took a great leadership team. It took making some really hard choices. It took shutting down customer service centers in different countries. It was hard. It was hard work, but we treated people with respect. We led through it and we got to the other side of it. But it was one of those moments where I was like, man, I really don't know if I can do this. And there were a lot of sleepless nights.
I'm so glad you gave that example too, because it reminds me like I used to struggle a lot with fear of failure. We touched on that a little bit, but also the imposter syndrome. So, and it was funny because like I noticed earlier, actually yesterday. So one of the larger, like more reputable healthcare organizations on the West Coast just made a decision to displace this huge, well-known three-letter company with us in regard to customer experience. And like we're moving forward. And it was like, it was a defining moment for us. And I realized I didn't feel that same feeling I had felt previously, which was like, oh my God, like they're choosing us. Cause for a long time, like you're saying, 14,000 people, like we have these huge organizations we're serving and they're like, they want to work with me. Do they know like that I'm like still figuring stuff out as we go? Like, and I think that's, there's something to be said for that. Yes, I have to be confident in my body of knowledge. I have to know how to ask for help. I have to surround myself with people that are smarter than me. I love that you mentioned people, process, technology, and culture. Like I think those like it's like I can put one foot in front of the other, and that happened for a reason, right? I earned that in doing the next right thing, and I've learned to not be overconfident, right? To not think I have it figured out because I don't. Like the leaders, like clearly you have a level of humility that I really appreciate in the leaders that I admire. The guys that again are advising these huge tech startups that are running really exciting organizations that have bought and sold companies. The guys that I respect the most, they still have that humility. They're learners, like lifelong learners. And that's what I try to emulate because a lot of this stuff is evolving as we go. To say you have it all figured out is just, it's just not true.
I think the problems that we're solving today are very different than the problems we were solving 15, 20 years ago. You look at, as we think at collective health, when you look at employers today, 5 years ago, they may have been solving for their employee experience. Now we're solving for cost savings, and it's cost savings and member experience, but it flipped, right? To where, and so of course we love that actually, because we believe that a better member experience drives a lower cost. And it's a true operational excellence kind of way of looking at things. And but employers, every single employer out there is really thinking about the bottom line. And they're thinking about how do I operate in this kind of macro environment, macroeconomic environment that we're in. And, oh, and we have a presidential race going on right now. So there's a lot of unknowns out there. And I think people are hunkering down. All right, let's wait and see what's going to happen here.
Yeah. Let's dive into collective health. Before I do, you did mention one really great book at the front end of the episode. I do always like to ask favorite book, either that you've read recently or one of your favorites all time. I'm sure you have a few good ones, so I'd be interested any recommendations you might have for me and my listeners.
There's quite a few books out there that on leadership. Good to Great is still one of my favorites. When eBay was going through the turnaround, we actually got to meet and hear from Jim Collins. And it was just, so it's professionally and personally for me, because it was at this moment of a time in the company in 2009. I was just like, wow, this is dark. It is- and
I graduated in 2009, so I know.
yeah, you were dealing with it from trying to find a job. It was a tough time. And so, but to have Jim Collins there and to talk to us about, you all have a great set of assets. You have a great leadership team. And so just giving us that confidence. And so it was very confidence inspiring for me to be able to go through that and knowing, hey, we've got these things over here. Because when you're in that dark of the storm, all you're doing is fixing stuff, and you're seeing all kinds of negative things, and you're just like going at it day by day. And so I think it's really important to keep that balance. And I think when I look at Good to Great, which is why I like the book so much, it's also just how I think about my own personal life. And so it's just, I think a lot of these books on leadership and on companies, and they can help you. If you look at them, there are broader themes that you can step back and take away from it. It's part of the reason why I like the book so much. And in fact, as I've been rereading it and I was looking at companies they studied, that back in the 90s, and I went out and looked at some of those companies today, and some of them aren't doing so well. And so then, of course, you ask the question, why aren't they doing so well? And so it's just, I don't know. I find that really interesting for me. And then there's several other books like out there, the 18, which is all about leadership and one team approach. So there's a number of books out there. I'm more than happy to send you a list of my top five, but I won't go through the boring list of what's inside Scott said.
No, no, expounding even on good to great, I think for the listeners was perfect. And now you tease some of the stuff you guys are up to at Collective. Interested in hearing a little bit more about your vision for the organization based on the mission of you and your colleagues, maybe some of the key initiatives you guys are working on. Maybe you could just share a little bit more about what you guys are up to.
Yeah, we're first and foremost, we're a very customer centric company. And when we talk about the customer, for us, there are two components to that. There's the client, the employer, that is actually setting up the health plan, and then we're administrating the benefits on their behalf. And then there's the member. There's their employees that call in, and one feeds the other. Very similar to an eBay, right? You have a buyer and a seller. There's two sides to the transaction. And a collective health, you have both sides. Without great member experience, you don't have clients that are happy and vice versa. One of the things we really pound into the company is voice of the customer. And really, we listen to our customers, we listen to what their top pain points are, and we develop products and services that actually meet the needs of what they're doing. And the really savvy benefit leaders, companies out there are trying to be innovative in how they drive benefit solutions for their employees. And they take a very deep, it's one of the biggest spends that a company has, right? And so a benefit leaders actually has two jobs. They have the CFO on one side and they have the employees on the other that they're trying to drive employee satisfaction for. And so part of our role is to help benefit leaders look like heroes. And so how do we put the benefit leader in the driver's seat of their health plan for their employees? And that's a very different approach than what the big healthcare companies do. And we're about transparency. We're about driving cost savings for the employer. Again, we're constantly looking at how we develop our products. How do we scale our technology so that we can support larger employers? Last year, we signed on a very large employer, and they are pushing us to do innovative things that we haven't thought of doing. Okay, we want you to be our benefits hub. We want one phone number for our employees to ever have to worry about. We don't want to give them a list of 5 phone numbers for their 401k, for their retirement, we want you to be that hub. So we did something different for them. We created a portal that allows their employees to come into it, self-serve, and be able to click and go right over to another company. And that may seem very simple, but in the healthcare space, and when you're thinking about putting yourself on the journey of the employee and the employer, that's what you have to do. You have to think very differently.
You guys are doing it, like you say, you have to, like you referenced before, there's a bunch of companies that aren't. And I think just the willingness and access that you're offering your customers to co-develop really or back into solutions that make sense for them based on their needs. The most successful businesses that I frequent or utilize are those. They're those that really have crafted their solutions based on the voice of the customer. You nailed it.
When you think about it, one of the other things that we pride ourselves on is when we do a plan design, so a benefit plan design for your benefits, right? We sit down with the employer and we're like, what do you want to solve for? And they're like, well, I want these three program partners or point solutions because we have an older population, our demographic, we're seeing a higher oncology rate, we're seeing a higher musculoskeletal, like we're seeing higher diabetes. So you gear the plan design around taking care of the higher population. And then you design the other part of the plan design where you're not necessarily putting your benefit towards that category. And so it's almost like a portfolio management type of an approach. And so year over year, a benefit leader can say, you know what, I actually want to move my dollars from spending here to spending over here to the right and get a higher utilization of that benefit. And that's part of what we do. And it's a very different approach. So you're actually putting your dollars where you need to put your dollars to get the highest value for your employees and to drive that higher benefit.
Love that. What about challenges you guys are facing as a business today? Is there anything, I know we touched on the political landscape, which I'm sure is tentative, right? But anything else you guys are facing that's challenging the business? And
Probably like any company out there, if you think back to the 80s and 90s, there were a lot of companies were in their swim lanes. And you fast forward to the internet, you fast forward to all these companies that are tech forward. What's happened is you've ended up becoming frenemies with companies. And so, for example, we leverage the healthcare companies for their networks, right? That gives us a network access because we sit on top of the healthcare networks. So the Blue Shields of California, the Anthems, the United Healthcares of the world. So we sit on that platform. And so we're very dependent on them. And we're very dependent on them for access to that provider network. And so you end up in this frenemy situation where I could be bidding on an employer and I could have my frenemy sitting there at the table actually competing with me. And so that just continues. And so it really forces you to think about what is the value that you're delivering to those employers and what is the value story and why are you so different than say that of a carrier or a big healthcare provider. What I would say is it's just that ongoing competition in the market and continuing to really refine our value proposition to employers. But yeah, it's operating in this world of frenemies that every company out there is probably faced with this day and age. And I think the internet brought a lot of that to the surface, quite frankly.
it's interesting because we even see that in our world in CX, this convergence of classically a lot of the software that just existed on its own island, different communications, omni-channel communications platforms, and not only the integration of all of those, which up until recently often needed to be done through third parties. Now there's a lot more native integration happening, but also the methods by which companies used to access these different platforms, channel partners, direct resellers, like all of that kind of coming together too. So there's situations now too where like we're competing with companies that technically we have relationships with to be their tip of the spear. It's very interesting, but it sounds like that's happening everywhere.
Yeah, it is everywhere. And I think if you look at the healthcare space, when you think about a traditional sale for us, we're working with an employer, we're working with a broker, we're working with the network, and then we're working with point solutions. So
Right.
all of those things have to line up to where the employer at the end of the day says, yep, I want to go down that path. And so our selling cycle as a result of that ends up becoming quite long and elongated.
Right.
And the larger the employer, the longer it takes. The smaller the employer, it tends to take less time. But there are a lot of variables in this industry. And
Yeah.
it's been one of the things that I've been probably most amazed about by joining it.
Yeah. And you guys are also, I imagine, beholden to those certain kind of buying windows, if you will, like in regard to benefits renewal and times that companies will look at things like this. That's very interesting. I've learned at least a few new things today. What about the healthcare industry in the future, Scott? Like, where do you see the healthcare industry going in the future? The understanding you don't have a crystal ball, but what do you think will be some of the biggest changes as time passes, either in kind of payer space or payer provider space, healthcare industry in general?
And if I maybe let me step back a little bit, if you think about one of the biggest problems we have right now, and so I'm also all about trying to get to the root of the problem you're trying to solve. And so when I think about healthcare, our healthcare spend as a country is just growing exponentially and it's going in the wrong direction. And part of the reason why we exist as a company and why we believe is that employers hold the keys to driving that healthcare cost down. And because they're the largest spend of healthcare, right? If you think about most employees are covered by their employer plan, which means that's the largest kind of category of spend with healthcare. And so I think you're going to continue to see pressure to reduce healthcare spend. So you hear a lot of that around kind of value-based care. How do you start to get more value for the care that you receive? How do you start to deliver that ROI and how do employers then start to influence the price of healthcare, given that they're the largest consumer of the healthcare kind of market, if you will? I think you're going to continue to see a lot of consolidation. And there's been a lot of consolidation to date in healthcare. And just like on the internet, there are going to be winners and losers. that game. And so it's hard to predict. One of the things that I would love to see happen is I would love to see providers be able to spend the time that they need with patients to deliver the right care. There are so many providers out there that are pressured into doing things because of contracts that they have. And to really start to get the balance back to where you're really solving for the patient at the end of the day, sitting there in the office or whatever the situation might be, and then the cost is reflective of that care versus all the add-ons that happen through all the different systems that it goes through. To answer your question at the more macro level, I think you're going to see consolidation. I would like to think that we're going to start to see a larger focus on driving down healthcare spend. And I think it's going to come from government pressure, and I think it's going to come from employer side. You're already seeing it as you think about pharma. Some of the changes that have happened on the transparency and pricing and drug prices and things like that.
Yeah. Well, and I love that. So I agree. And I love that you talked about at the onset, the treating the root of the cause and not just in a healthcare setting from a organizational wiring setting too, but it specific to treatment, right? I was having this conversation with Doug Bruce. He's the chief medical officer, the Metro Health system. Actually, his episode just dropped, and we were talking about how uh, for a patient that is suffering from addiction, or a patient that's substance use disorder or eating disorder, like they're overweight, they have diabetes. Right? So often, what we see healthcare providers doing is treating the symptom and not the actual root issue, right? Like, the root issue of my substance use is significant trauma that I experienced starting at age 5 and then I developed this coping mechanism, just trying to treat or shake the person and say like, why are you doing this? Why are you overeating? It doesn't work like, and I think often that healthcare system can perpetuate that. And there's so much money being spent on ineffective treatments. That's one way we would look to attack like that kind of overspending, right?
That's exactly right. By the way, it's a great podcast. So I just listened to it.
Oh, thank you.
I actually really enjoyed the conversation because it's actually it's not dissimilar to how we're also thinking about things at Collective Health. Yeah, kudos to both of you. It was a great discussion.
Yeah, awesome. This has been a great discussion, Scott. It's been such an awesome time. We always just like to end the episode with, if you could go back 5, 10, 15 years in time, what advice would you give your younger self?
Boy, there's a lot of lessons. I'm back to don't give in to the fear. Whether it's you're questioning whether you're good enough to take the next step in your career or to go to another company for something that's being presented to you, have trust that the people that are asking you to do that see something in you that maybe you don't see in yourself. And when I think back to my kind of pre-eBay work life, I'm now very attracted to purpose-driven companies. And I would say before eBay, those weren't necessarily purpose-driven companies. And I am addicted to purpose-driven companies because they make you better as an individual, and they actually line up better with who you are as a person. But so two things I threw in there. One is have belief in yourself. Don't give in to the fear, lean into it. And I can point out example after example. And it's hard in the moment. It's really hard in the moment to pull yourself back. And I have a trusted group of advisors that I reach out to. And I'm just like, hey, I'm seeing this. And that's so important. And they end up being the best friends you will have. And it's really critical to have that trusted group of advisors to lean on, because in the thick of the moment, it's hard to pull yourself out of it.
I love that you brought that up too, because I wasn't thinking about that, but like having someone who could hold up that mirror where maybe I haven't seen something yet in my blind spots, just that trusted group of friends. And for me, being willing to ask for help, all just things that I wish my younger self knew too. Scott, this has been awesome. Thank you so much for taking the time.
Yeah, likewise. This is great. So look forward to talking more.
Yeah. And to our listeners, thank you for tuning in. We will catch you all next week.